Some people feel as though the banning of Mifepristone is necessary for the health care of women everywhere. However, the banning of Mifepristone would only cause the opposite effect. Mifepristone is a drug that is used to end pregnancies, along with another medicine, Mifepristone. Pregnancies under 10 weeks can be safely terminated. However, with the banning of Mifepristone, doctors who perform abortions will have to rely solely on Mifepristone, which causes many more side effects such as nausea, vomiting, and diarrhea, not to mention a longer duration of cramping and bleeding. Overall, a much more painful experience for a woman already making such a difficult decision. Mifepristone has proven to be one of the safest ways to abort an unwanted pregnancy. Out of the 3.7 million women who have undergone a medicated abortion, only 24 passed away. The banning of Mifepristone will only cause that minuscule number of deaths to increase drastically, with these individuals having to seek other ways of termination, much more dangerous ways of termination. Before releasing Mifepristone to the world, the FDA did a thorough and comprehensive review of this drug and decided that it was safe and effective for use. This was over 20 years ago. The overwhelmingly positive effects Mifepristone has had in the past 20 plus years further proves that banning this drug will be detrimental to the health of women everywhere. On top of that, there is no concern about the misuse of this drug, being that the only way to receive Mifepristone is through a prescription by a healthcare provider that meets all of the following qualifications. Firstly, in order to be certified to prescribe Mifepristone, healthcare providers must complete a prescriber agreement form, as well as fully briefing the patient of all the risks associated with said treatment method. The patient is also provided with a copy of the patient agreement form and Mifepristone medication guide, which is full of FDA-approved information for the patient. So not only is Mifepristone a safe and effective part of the two-step process of an abortion, it has also proven to be a safer alternative to many other processes of abortion. Undergoing meticulous review by the FDA over 20 years ago, and being thoroughly watched and updated to this day, there has been no evidence to prove that any harm has come from Mifepristone, and banning it would be absolutely unnecessary and harmful. No one wants to be held responsible for the fully preventable side effects and deaths that the banning of Mifepristone will be sure to cause. The health care of women everywhere is at risk.